Hello, everyone. Let's begin our lecture series on Let's Simplify Orthodontics for final BDS students. The first topic in this series is Introduction to Orthodontics. What is orthodontics? Orthodontics, as we all know, is a science associated with the movement of the teeth within the jaws. It's a branch of dentistry concerned with prevention, interception, and correction of malocclusion and other abnormalities of the dentofacial complex. There are many definitions of orthodontics, but the most accepted definition is given in 1922 by British Society for Study of Orthodontics, also known as BSSO. It says orthodontics includes the study of growth and development of the teeth, of the jaws and the face particularly, and the body generally, as influencing the position of the teeth. The study of action and reaction of internal and external influences on the development and prevention and correction of arrested and perverted development. We can simplify this into four parts. First, orthodontics includes the study of growth and development of the jaws and face particularly and the body general. Part 2, influencing the position of the teeth. Part 3, the study of action and reaction of internal and external influences on the development and the prevention and correction of arrested and perverted development. Other definitions include the definition given by Dr. Edward Anger in 1907. It states that the objective of the science of orthodontics is correction of malocclusion of the teeth. Noyes in 1911 defined orthodontics as the study of relation of the teeth to the development of the face and the correction of arrested and perverted development. Common question asked in exams is what are the aims and objectives of orthodontics? Aims of orthodontics, as described by Jackson in the form of a Jackson's triad, are functional efficiency, structural balance, and aesthetic harmony. Let's see each one in detail. Functional efficiency means restoration of normal functions of the oral cavity. Now, which are the normal functions of the oral cavity? Mastication, deglutition, and phonation. Phonation means speech. It's a known fact that malocclusion affects any one or all of the functions of the oral cavity. For example, anterior open bite, spacing in the anterior teeth leads to abnormal speech in the form of a lisp, in the form of tongue thrust, or in the form of mispronunciation of certain letters like S and F. Proclination of teeth leads to mouth breathing. Narrow upper arches leads to deep palate, thus affecting deglutition and narrowing of the respiratory passage. One of the primary aims of orthodontic treatment is restoration of the oral functions to their maximum efficiency. Second is structural balance. It is self-explanatory in the sense it means balance between the hard and the soft tissues. Hard tissues in this case is the teeth and the basal bone, and soft tissues is basically the musculature which houses these teeth and the bones. The musculature in this case is the buccinator mechanism, the tull musculature, the orbicularis oris, and the mentalis muscle. The aim of orthodontic treatment should be that both the tissues, that is the hard and the soft tissues, should work in sync. Failure to achieve this structural balance is considered the primary cause of relapse. Aesthetic harmony. This is one of the primary aims of orthodontic treatment from the patient point of view. A pleasing smile accompanied by a pleasing facial appearance with establishment of Andrew 6 East normal occlusion is the cherry on the cake after orthodontic treatment. Objectives are not to be confused with aims of orthodontics. Going by the dictionary, aims are basically described as general statements of intent. That is, what do we intend to do after orthodontic treatment? What is our goal in mind? Objectives are basically specific, measurable, and time bound steps undertaken to achieve those aims. The objectives of orthodontics were specified under the heading of goal oriented approach as given by Roth Williams. What do you mean by goal oriented approach? Goal goal oriented approach means, as they say, begin with the end in mind. So, which are the different objectives of orthodontics? Functional occlusion. Functional occlusion was first described by Ronald Roth. It is basically described as the occlusion to be achieved at the end of orthodontic treatment that is most beneficial for performing different oral functions, that is deglutition, mastication, speech. The final position of the teeth should be such that all the above mentioned functions are restored to their maximum efficiency. Aesthetics. Aesthetics are broadly classified into macro aesthetics, micro aesthetics, mini aesthetics. One of the primary objectives of orthodontic treatment is to achieve all these three within a specific period of time. Facial harmony, usually associated with the harmony of the dentition and the facial musculature. The facial musculature is basically those musculatures which house these teeth. Pleasing facial aesthetics are usually associated with the restoration of facial harmony. Long-term stability, one of the most challenging objectives of orthodontic treatment. Prioritizing or not prioritizing all the other objectives can compromise or benefit long-term stability of orthodontic treatment. Temporomandibular joint health. It is a known fact that malocclusion has long-term deleterious effects on the temporomandibular joint. It is manifested in the form of jaw deviation during oral functions, dual bite, facial asymmetry, wearing out of the condylar eminence or the articular eminence, pain in the TMJ. Timely intervention by an orthodontist should include optimizing temporomandibular joint health, which can reverse the damage to the TMJ and restore normal TMJ function. Periodontal health. The best periodontal health achieved after orthodontic treatment is by positioning of the teeth adequately over the base of bone, adhering to Andrews 6 keys to normal occlusion. It ensures the longevity of the teeth. Patient satisfaction. Achievement of all the above mentioned objectives generally leads to patient satisfaction. Usually, this is associated with aesthetics and facial appearance. But here, both the patient and the orthodontist must understand that it is a very complex science where all the objectives need to be prioritized and achieved without compromising on any. Scope of orthodontics. Scope means an opportunity to change something. Malocclusion affects three main tissue systems in the body. First is the dentition, second is the skeletal pattern, and the soft tissue pattern. Dentition means teeth, skeletal pattern means the jaws, that is the maxilla and the mandible, and the soft tissue pattern, in this case, the intraoral and extraoral orofacial musculature. Orthodontic treatment can bring about alteration in the tooth position, alteration in the skeletal pattern, and alteration in the soft tissue pattern. Alteration in the tooth position states that teeth can be moved from the present incorrect position to their correct ideal position where they can be of maximum use or utility to the patient. The movement of the teeth is within the basal bone by application of certain amount of force. This way, ideal occlusion can be achieved after orthodontic treatment. Alteration in the skeletal pattern. Malocclusion can also involve the maxilla and the mandible along with the teeth. Such kind of malocclusions are called skeletal malocclusions. This leads to skeletal disharmony in the form of deviation in the size and the position of the jaws, as well as the relationship of the upper and the lower jaw. Application of orthopedic force, not orthodontic force, orthopedic force. Orthodontic forces are light, orthopedic forces are heavy. Application of orthopedic forces can bring about a restraining or promoting or redirecting growth of the jaws, which can be normalized as well as correcting of the skeletal relation between the jaws. Correction can be achieved in all three planes of space, sagittal, transverse, and vertical. Alteration in the soft tissue pattern. Malocclusion also affects the soft tissue balance as mentioned earlier. This imbalance in the soft tissue musculature affects the placement of the dentition and the skeletal pattern. Orthodontic treatment can bring about change in the soft tissue pattern in a more favorable manner so as to house these teeth correctly over the basal bone. Sequelae. Sequelae means the after effects of a malocclusion. What are the after effects or the sequelae to malocclusion? They can be divided into different headings. Like first is poor facial appearance. It is usually associated with proclination of the teeth, prognathic or retrognathic maxilla or the mandible. Cleft lip and or a cleft palate can also have adverse effects on the facial appearance. Risk of caries. Malalignment of teeth makes maintenance of oral hygiene difficult, thus leading to increased risk of caries. Malocclusion also leads to poor contact points in the teeth, which can also lead to proximal caries. Predisposition to periodontal disease. Inadequate oral hygiene. Deep bite. Trauma from occlusion. Habits like mouth breathing, tongue thrusting, etc. can lead to increased loss of periodontal support to the teeth, thus leading to different periodontal diseases. Psychological disturbances are usually associated with poor facial aesthetics and appearance. Malocclusion can turn a perfectly otherwise normal person into an introvert or a self conscious person. Risk of trauma, usually associated with proclined teeth, who carry with them a high risk of injury. Abnormal functions. Malocclusion affects the normal functions of the stomatomatic system, such as deglutition, there are defects in speech, and improper respiration. For example, mouth breathing. Temporomandibular joint problems. These are generally long term effects observed with malocclusion. Malocclusions associated with occlusal prematurities, anterior deep bite, are believed to be a primary cause in temporomandibular joint pain and temporomandibular joint dysfunctions. In this segment, we will be answering some commonly asked Viva questions. For example, what is the difference between aims, objectives, scope, and sequelae? Aims. Aims is basically a very broad statement of intent. Intent means what do you intend to do after orthodontic treatment? Like they say, begin with the end in mind. So the end in mind becomes your aim. Okay. Objectives is basically what steps are you going to take. That is, their steps are measurable and all steps are time oriented. Okay. What steps you are going to take to achieve those aims within a specific period of time. As we all know, that orthodontic treatment or any treatment can't go on forever. It has to begin at a specific time, it has to end at a specific time. So, whatever objectives you need to achieve, okay, within that specific period of time, they are your objectives. And the scope. Scope is basically what opportunity the subject holds for you. Okay. What is the opportunity? It is basically grammatically scope means opportunity to change something. In this case, what are you changing? You are changing the position of the teeth. You are changing the position of the jaws if needed. And you are altering the soft tissue pattern. Okay. So all these become the scope of orthodontic. Sequelae. Sequelae is basically, sequelae means the after effects of a particular condition. In this case, sequelae to malocclusion becomes after effects of a malocclusion. This sequelae can be a short-term sequelae or a long-term sequelae. For example, if there is proclination of teeth, a short-term sequelae will be poor facial appearance, a convex profile. Okay, spacing of the teeth, short term will be lisp, tongue thrust. Okay, but long term sequelae means proclination of the teeth can lead to mouth breathing, dryness of the mouth, increased risk of dental caries, risk of periodontal disease, TMJ problems, etc. So these are the sequelae to malocclusion. If you like our lectures, do like, share, and subscribe to our YouTube channel. For any doubts or queries, kindly mail us on our official email ID, let's simplify orthodontics@gmail.com. Your feedback is valuable. Thanks for watching.